Common causes of pelvic pain in men. Pelvic pain occurs between the navel and groin. It may result from a urinary tract infection, sexually transmitted infection, or prostatitis, which is inflammation of the prostate. These issues are relatively common. The National Institute of Diabetes and Digestive and Kidney Diseases (NIDDK) estimate that chronic pelvic pain syndrome affects 10 to 15% of the male population of the United States. Pelvic pain often occurs with other symptoms. Treatments vary depending on the cause, so it is essential to receive a thorough checkup in each case. Urinary tract infection or UTI. A UTI is a bacterial infection somewhere along the urinary tract, which includes the urethra, bladder, ureters, and kidneys. UTIs are a frequent complaints, and a more common symptom is pain in the lower abdomen or pelvis. Other symptoms include a burning sensation while urinating, needing to urinate frequently, changes in the color or smell of urine, fever or chills, pain in other areas such as the sides or lower back. A doctor will treat a UTI with a round of antibiotics. Sexually transmitted infection (STI). Some STIs such as gonorrhea and chlamydia also cause pelvic pain. The Centers for Disease Control and Prevention (CDC) estimate that 2.86 million chlamydia infections occur in the US each year. Symptoms include pain in the pelvis, inflammation in the urethra, discharge from the penis. Chlamydia may also infect the rectum or anus, possibly causing pain there as well. Gonorrhea infects about 8.20 lakh people annually, according to the CDC. The infection may cause symptoms such as pain and discharge from the penis. If it affects the rectum, it can cause discharge from the anus or painful bowel movements. Prostatitis. Prostatitis is inflammation of the prostate, a small gland in the male reproductive system. The prostate produces a fluid that goes into semen. Hernia. Sudden pain in the lower abdomen may indicate a hernia. A hernia develops when a piece of tissue or intestine pushes out through a weak point in the muscles. It often forms a small painful bulge in the area. The pain may grow worse when the person strains the muscles, such as when laughing, coughing, or lifting. About 25% of males will experience a hernia, typically as they age and the muscles become weaker. Surgery is the only treatment, and it is necessary in order to prevent severe complications. Irritable bowel syndrome (IBS). IBS commonly causes symptoms along the intestinal tract such as painful cramps, bloating, diarrhea, constipation, mucus in the stool. These symptoms tend to go away temporarily after a bowel movement. Doctors may recommend lifestyle and diet changes to help provide relief, and medications may help control some symptoms. Appendicitis. The appendix is a small organ on the right side of the body, and inflammation in the appendix can cause pelvic pain. Other symptoms include fever, loss of appetite, nausea and vomiting, swelling in the lower abdomen. If sharp pain in the lower right abdomen accompanies any of the symptoms above, seek immediate medical attention. Surgery may be necessary. Urinary stones. Urinary stones form when salts or minerals such as calcium build up in the urine, and the body has trouble getting rid of them. These minerals can clump together and crystallize into urinary stones. The stones only tend to cause symptoms when the body tries to pass them, and pain in the pelvis or lower back is common. Other changes include difficulty urinating and blood in the urine. Doctors may prescribe pain medication to help with passing the stones, and some medicines may break up the stones. The largest stones require surgery in some cases. Cystitis. Cystitis is inflammation in the bladder generally resulting from infection. It causes pain in the pelvis along with symptoms including difficulty urinating, a weak urine flow, having to urinate frequently, burning pain when urinating, blood in the urine, changes in the look or smell of the urine. A doctor will typically use a short course of antibiotics to treat a bladder infection. Urethral stricture. Urethral stricture occurs when the urethra narrows or becomes blocked, making it difficult for urine to flow out. Beyond pain in the lower abdomen, symptoms include pain while urinating, trouble urinating, leaking urine, blood or urine appearing in semen, a loss of bladder control. Treatment tends to involve a surgical procedure, and this vary. Benign prostatic hyperplasia (BPH). BPH occurs when the prostate gland enlarges due to something other than cancer. As the prostate expands, it presses on the urethra. This can cause trouble urinating and pain in the pelvis. Eventually, the bladder muscles may weaken from the strain, making the symptoms worse. BPH grows more common with age, affecting at least 50% of males older than 50. Treatment may include lifestyle changes, medications, and surgery. While occasional pelvic pain is common, anyone unsure about the source should see a doctor. Even if the cause of the pain is clear, any changes such as increasing severity may signal the need for a medical reassessment. Identifying the underlying cause of pelvic pain is important. Even seemingly simple issues such as UTIs often need treatment to prevent serious complications. Anyone unsure about the cause of pelvic pain should see a doctor.